So today on Your Day with Anna Koyman, our guest is Dr. Lori Gentile from Novant Health. She's a surgical breast oncologist, and she's here to share 5 things we may not know about breast cancer. Good morning. Thanks for joining us.
Thank you so much for having me.
Fresh out of surgery, so you're doing some miracle work. Thank you for that. Thing number 1 is that breast cancer does not always manifest as a lump. That probably has some people scratching their heads this morning.
You got it. We commonly hear about breast cancer being diagnosed as a lump that a woman feels. However, the number 1 symptom of breast cancer is actually no symptom at all.
Wow.
And today, the vast majority of women are actually diagnosed on screening mammograms. And using screening mammograms, we're able to find cancer at much earlier stages, well before a lump can be felt on the outside. Breast cancer can present some warning signs though, and those warning signs can be things other than a lump. So it can manifest as swelling of the breast, thickening of the skin, or discoloration, or changes to the nipple. So those are changes that women should be aware of if they were to notice those within their own self-exam.
So early detection is best, so we want to make sure we're paying attention to that. Another thing that may have you surprised is that many women with breast cancer actually do not need chemotherapy.
That is true. So with all the research that we all partake in and know about during Breast Cancer Awareness Month, many new studies have studied the genetic makeup of tumors. And so the most common type of breast cancer that we do detect is an estrogen receptor positive cancer. And over 70% of women, based on these new studies with estrogen receptor positive cancer, actually have been found to not benefit from chemotherapy. So we have excellent survival rates in modern day utilizing oral medications for treatment rather than chemotherapy. And in some other harder types of cancers to treat, we have other new options that all this research has come to find, such as targeted antibody therapies, immunotherapies, or other antibody drug conjugates. So lots of options for treatment other than chemotherapy these days.
Right, that's music to a lot of people's ears probably when they get that diagnosis. Another myth that may surprise people is that although age is a risk factor, younger women can be diagnosed with breast cancer too.
Definitely. The incidence of breast cancer definitely increases as a woman ages, but it's surprising to know that in the United States, 1 out of every 69 women diagnosed with breast cancer will actually be in their 40s. And studies do show approximately 13,000 women in the United States each year under the age of 40 will be diagnosed as well. And oftentimes it's these young women who aren't undergoing their screening mammograms yet. So those would be times when women need to be doing those monthly self-breast exams and paying attention to any changes in their breasts.
Okay, where can we go to find out information about how to do these self-exams?
So there are resources online, and the new term is really breast self-awareness, or being aware of how your breasts are, how they change on a monthly basis, and then noticing any changes. And when you see any of those changes, to bring those changes to the attention of your primary care physician.
All right, and this next thing that may surprise some of you at home is that it's actually great, is that it's not all doom and gloom. Survival rates are improving year over year.
You got it. So that's very, very true, and that underscores the importance of screening. And so the earlier that we detect a cancer, the higher the survival rates are. And so when cancer is detected at very early stages, stage 1, 2, and even sometimes stage 0, the survival rates are as high as 98 to 99%. So most women with breast cancer really do incredibly well.
Okay, and if you're somebody who thinks that mammograms don't work, well, this will surprise you. Regular mammograms really do work, and you really encourage everybody to start when?
We do. So the American College of Radiology, as well as the American Society of Breast Surgeons, do recommend starting routine screening mammogram at the age of 40. The American Cancer Society recommends starting at 45 with the option to start as young as 40 for women who are interested in that or who have a family history. And so we just know that catching cancer at earlier stages requires less treatment to achieve those very high success rates.
Yeah, and you doing interviews like this on Your Day with Anna Koyman helps to raise that awareness and get people to screen a bit earlier. Thank you so much.
Definitely.
Dr. Lori Gentile, surgical breast oncologist with Novant Health. We appreciate it.
Thank you.
If you enjoyed this video and some of the other ones that you've seen here on the Your Day with Anna Koyman page, make sure you hit that notification bell so you find out when we release our next video. See you next time.